Hi, I'm Mark Duncan, Clinical Director at LVI, and I want to welcome you to another episode of LVI TV, your weekly dental news source. This is a tragic story, and while it isn't terribly common anymore, it hits at the core of anyone who's affected. In Ohio, a mother and sister are sharing their horror story about a 31-year-old young man who made a tragic misinterpretation. Thinking he had a sinus infection, he held out and didn't get it evaluated. However, it turned out he had a tooth infection. It was aggressive and nasty enough that he got septic and the infection spread through his entire body, suffered multiple organ system shutdowns, and what should have been easily treated at earlier stages wound up having open heart surgery and shortly after passed away. Thinking it would resolve on its own, he waited for things to get better. Afraid of the cost or assuming it wasn't so severe, he just pushed it off until it was too late. The reality is, almost half North Americans have at least one tooth that would benefit from treatment, and tooth decay is second only to the common cold as the most prevalent infection in the US. Screening isn't hard. As a matter of fact, it's quite simple. It just takes a system and a dedicated team. And there are 6 screens that every patient should routinely get. Health history should be reviewed and reviewed on purpose. Head and neck, hard and soft tissue cancer screening exams should be done and should be done out loud with the patient. And sure, it may be new for your patients, as generally it's missed or it's kept a secret. In fact, some patients may actually say things like, "I don't like being touched," and that's their choice. Now, we still aren't doing a great job of periodontal infection screening, so doctors, pick up that perio probe. And although we do seem to do a pretty good job of screening for infections in teeth, we're completely skipping occlusal disease or bite dysfunction. Of course, the other thing that most dental practices aren't even looking at yet is screening for airway. And so the public is making poor choices because we've done a bad job of letting them know how important dentistry is. It's not just about white teeth, it's about systemic health. And the white teeth are the gravy. So it's time for us to step up and inspire our patients to connect those dots so that they can do the dentistry that both they want and they need. If it's done properly, they'll do whatever it takes. If they value and want the care, they'll afford the time and they'll afford the energy. They will find a way. In fact, check this out. In Sweden, a 51-year-old inmate actually broke out of prison to go to the dentist. He'd been hurting for about 4 days and finally had enough. He broke out of jail, went to the dentist, got some relief, and then turned himself back in. He had to pay the price, though. They held him for an additional day to make up for his day passed, but at least he was pain-free. If an inmate values their dental health enough to give up another day of freedom, what do you think your patients want? Healthy is healthy, and our professional responsibility is to deliver the best evaluation, the best options that science provides. That means training and improving your skills for the rest of your career. Don't forget to like us and make sure that you don't miss any episodes. Subscribe to LVI TV here. And I have a question for you. Now, what tools are you using in your office? Whose lives have you touched by delivering comprehensive care in your practice? Please share your stories below, and we'll see you next week. I'm Mark Duncan.